Hello, my name is Vincent Idemyor. I'm your host. Dr. Vincent Idemyor, for many years, has been involved in combating the HIV/AIDS epidemic in Nigeria and the United States. A clinical pharmacologist and HIV research scientist who divides his time between Nigeria and Chicago, Dr. Idemyor has had several awards and recognitions attached to his stethoscope for his contributions to HIV/AIDS research, training, treatment, and prevention activities in both Nigeria and the United States. He was recently awarded the Medical Award of the Year from the Washington-based National Technical Association at the organization's national conference in Baltimore. Dr. Idemyor is on the clinical faculty of the University of Illinois, College of Medicine, Section of Infectious Diseases. He is also a visiting professor at the University of Port Harcourt, Nigeria, Ahmadu Bello University, Zaria, also in Nigeria. Dr. Idemyor has organized conferences in Nigeria to train professionals about AIDS. For many years, he has been involved in the clinical trial development of new pharmaceuticals. He recently was the lead international consultant of a definitive study of Nigeria's national effort to combat HIV infection, funded by the United Nations system in Nigeria. Welcome to the program, Dr. Idemyor.
Thank you very much. I'm glad to be here.
This very lethal disease is known to be pretty much an equal opportunity killer. It doesn't know any boundary. It doesn't recognize your color. It doesn't recognize your national origin or even your faith for that matter. But you decide to zero in on Nigeria. Why Nigeria?
Well, first and foremost, I'm a Nigerian. And also, Nigeria is the third largest in terms of absolute numbers. It's the third largest infected HIV country in the world.
The third largest?
Yeah, the third, yeah, number 3. Number 1 is South Africa. Number 2 is India. And number 3 is Nigeria. We have about 3.5 million infected cases, HIV-infected cases in Nigeria. And so because of that, I felt it was quite important as a Nigerian to start focusing on the issues in Nigeria, so as a way to find a way to combat the epidemic in Nigeria.
But it's kind of interesting because I'm just finding out now, just by speaking to you, that that country is the third largest country that has the largest HIV epidemic. But is this fact actually known to the Nigerian population and to governments and to people out there?
Yeah, the government, the people in government are aware. The National Action Committee on AIDS in Nigeria, they are quite aware. They speak about it. The Minister of Health, folks in the Ministry of Health, they are quite aware. What happens is that people talk about prevalence. And because the prevalence is around 5% or so, and then they start comparing the prevalence with other countries with higher prevalence. But because we have a huge population, so even with a prevalence of 5% or so, when you look at it critically, then the numbers, absolute numbers, are going to be huge. The same thing with India, because the population in India is very huge, even though the prevalence is low. So the absolute numbers are going to become large. So that's what happens there. So the people in Nigeria are aware. Those in the thought leaders that are supposed to know, they are aware. But I don't know whether the entire populace are aware or not. And I think that's why we have to get the message across. You know, constantly educate, let people know what is happening so that they can get prepared and get civil society involved.
You've been pretty much involved in this AIDS research now, and I think together with your other colleagues out there, you know, all over the world, are pretty much working day and night to find a solution, so to speak, to these diseases. So, how far, you know, are we close to nipping this very, you know, killer disease in the bud, or we're just too far away from it?
Excellent question. We don't have a cure yet, but the drugs are available. We have good drugs. We have 20-something drugs that are available that's been approved by the Food and Drug Administration that can actually be used in these people who are infected you can treat these individuals and then they'll get well. They live a normal life.
What do you mean they get well? They get cured? Is that what you're saying?
No, there's no cure.
Okay.
There's no cure.
So they don't get well then?
Well,
they just manage the disease, just like you manage maybe diabetes or whatever.
Well, I can say they get well because they live their life normally like everybody else. You know,
so are we saying
a clear example would be a fellow like Mervyn Johnson.
Okay.
He's doing everything that you and I can do, you know, normally, yes. All you have to take, all you have to do is just you should take your medication. Okay. Just like fellows with arthritis, they take their medications and then they live their normal life. You did mention diabetes. Yeah, they take their medications, they live their normal life, yeah. So there is no cure for HIV/AIDS, but at least then we have drugs that are available. It's not a death sentence anymore because of these drugs. And before it used to be a death sentence, but it's not a death sentence anymore because of these drugs, even though it's still a death sentence in Africa.
Pretty much, it looks like people in the Western world can afford the drug, and the government can actually provide the drug almost at rock bottom price. But it is not the case in developing countries and underdeveloped countries. So how are we going to be able to overcome this non-availability of drugs? We have to talk to the pharmaceuticals. Who's supposed to get involved to actually make these drugs available to people who have the disease?
Another good question. It's going to be the effort of everyone. Now you can get the drugs down to as low as $350 per person per year.
That's a lot of money for an average person in Africa.
Yes, it's still a lot of money, but we're not saying that the individual should be the one only to bear the cost of it. Government's got to get involved. The other sectors of society must get involved. In the past, it was quite high for people for even government to be able to afford the drugs. But now it's come down to as low as $350 per person per year. So it's affordable, and civil society can get involved, other parts of society can get involved, government can get involved, so that we can make the drugs available to those that actually need the drugs. Because if we don't get the drugs available to these individuals, then there's no point for us to be talking about this disease. We must find a way to get the drugs available to them, teach them how to take the drugs, so that they can live a normal life.